Hello everybody, my name is Lorna May L, and I'm a third-year nursing student. This is the third video of a four-part video series where I talk about different topics and a summary of the information that we need to know about them. So, to learn more about thrombotic disorders, keep on watching. In this video, we will be talking about thrombotic disorders and a summary of what we need to know about these diseases. First, what is the definition of thrombotic disorders, or what are thrombotic disorders? Thrombotic disorders are defined by the formation of clot in the bloodstream which blocks the blood vessels. Take note, formation of clot in the bloodstream, therefore blocking the blood vessels. There are two main types of thrombotic disorders. First is the venous thrombosis. It has subtypes such as portal or renal or jugular vein thrombosis, deep vein thrombosis, pulmonary embolism, Budd-Chiari syndrome, Paget-Schroeter disease, and central venous sinus thrombosis. For Budd-Chiari syndrome, it is thrombosis in the hepatic vein. For the Paget-Schroeter disease, it is the thrombosis in the upper extremity vein. For the cerebral venous sinus thrombosis, it is the thrombosis in the venous channels of the brain. Next main type of thrombotic disorders is the arterial thrombosis. So arterial thrombosis has two subtypes, like the thrombotic stroke and the myocardial infarction. So what are the risk factors for thrombotic disorders? I have categorized the risk factors into the venous thrombosis and both the venous and the arterial thrombosis. For the venous thrombosis specifically, there is the history of deep vein thrombosis, hormone therapy or birth control pills, and pregnancy. For both the venous and the arterial thrombosis, there is a family history, immobility or lack of movement, smoking, diabetes mellitus, and the famous varicose triad. So under varicose triad, there is the endothelial damage, hypercoagulable state, and stasis of the blood. Under arterial thrombosis specifically, the risk factors are high cholesterol, poor diet, and older age. Let us move on to the causative factors of thrombotic disorders. This is specifically for venous thrombosis. You can see on the screen the varicose triad, the endothelial damage, hypercoagulable state, and the stasis of the blood. Under endothelial damage, there is the dysfunction and the damage of the endothelium. First, for the endothelial dysfunction, there is smoking and hypertension. This can cause venous thrombosis. For the endothelial damage, there is surgery, catheter or specifically the PICC lines, and trauma. For the hypercoagulable state, under the hereditary category, there is a factor V Leiden, prothrombin G2021-0A, protein C and S deficiency. Under the acquired hypercoagulable state of the blood, there is cancer, chemotherapy, hormone replacement therapy, pregnancy, obesity, and heparin-induced thrombocytopenia. Under stasis of the blood that causes venous thrombosis is immobility and polycythemia. For the arterial thrombosis, there is still the varicose triad, the endothelial damage, hypercoagulable state, and the stasis of the blood. Under the endothelial damage, there is the dysfunction and the damage of the endothelium. For the endothelial dysfunction, it is still the same as the venous thrombosis except with the additional older age. For the endothelial damage, on the other hand, there is arteriosclerosis. So arteriosclerosis is known as the thickening or the stiffening or the hardening of the arteries. It has three types that causes arterial thrombosis. So first is the atherosclerosis. Atherosclerosis is basically the plaque buildup in the blood vessel walls. This is usually due to high lipid content in the body or the high fat content in the body. Arteriolosclerosis is the hardening and the loss of elasticity of the arterioles or small arteries. For Monckeberg's arteriosclerosis, this is a form of arteriosclerosis or vessel hardening where calcium deposits are found in the muscular middle layer of the walls of the arteries, also known as tunica media. In the hypercoagulable state, there is the hereditary and the acquired, same as the venous thrombosis. For the hereditary, there is diabetes mellitus and the dyslipidemia. For the acquired hypercoagulable state, there is obesity and also dyslipidemia, as it can be both hereditary and acquired. For the stasis of the blood, there is immobility. Next, what are the signs and symptoms of thrombotic disorders? First, leg warmth, redness, and swelling. So leg warmth, redness, and swelling are possible indications of deep vein thrombosis. Chest pain or angina and shortness of breath are possible pulmonary embolism indications. So since in the first and the second signs and symptoms, there could be a possible deep vein thrombosis and pulmonary embolism diagnosis, this can also be considered as signs and symptoms, as these are types of thrombotic disorders. Next is superficial thrombophlebitis. And for the fifth, weakness or numbness of one side of the body, problem in speaking, and problems with balance and walking, which are possible indications of ischemic stroke. And the last one, but not the least, is the abdominal pain. So abdominal pain is an indication of possible mesenteric ischemia. So how do we detect thrombotic disorders? First is medical history. There is also physical exam, ultrasound, blood tests, venography, and MRI or MRA or CT scan. So what is the pathophysiology of thrombotic disorders? It is actually a very complex mechanism, but it is summarized into the diagram as you can see on the screen. There are three types of colored boxes on the screen. The first set of boxes, the gray boxes, are the etiology or the causative factors of thrombotic disorders. The light blue colored boxes is the mechanism or the disease process. The dark yellow boxes are the signs and symptoms. So, for the varicose striae, the endothelial damage, the hypercoagulable state, and the stasis of the blood, as you can see on the left side of the screen, this causes the clot formation to typically occur in the leg veins. And then mechanisms such as deep large veins allow for blood pooling, causes stasis of the blood or hypercoagulability of the blood. Venous return from legs, often against gravity, also causes stasis of the blood. Valves in the leg veins become prone to backflow, which also causes stasis of the blood. So these mechanisms instigate two processes, which is the destruction of the vein valve by the clotting, and clot embolizes to the lungs. For the destruction of the vein valve by clotting, this causes venous insufficiency and therefore produces signs and symptoms such as unilateral leg edema and venous inflammation. For the clot embolizing in the lungs, thromboembolus can occur, which causes diseases such as pulmonary embolism and chronic thromboembolic pulmonary hypertension. This is basically how venous thrombosis occurs. On the right side of the screen, the family histories, the dyslipidemia, hypertension, diabetes mellitus, smoking, older age, and immobility all causes different mechanisms. So first, the dyslipidemia. High-density lipoproteins, or basically the good cholesterol in the body, aids in transport of the low-density lipoproteins, which is the bad cholesterol of the body, from the periphery back to the liver for the breakdown. So low levels of the HDL allow for more rapid accumulation of the LDL in the vessel walls. Before we proceed on to the last two blue boxes, first, for the hypertension, the diabetes mellitus, and the smoking, this causes direct arterial endothelial damage. Now, all of this causes more LDL to diffuse across damaged endothelium and accumulate in the intima layer of the artery wall. LDL in the intima is oxidized into the lipids that trigger chronic inflammation in the vessel wall. Before we proceed on with that part of the pathophysiology, first, what does older age and immobility contribute to the formation of the arterial thrombosis? Older age and immobility causes the calcification of the arterial walls due to the loss of elastic fibers of the muscles in the body. Now, proceeding on to the continuation of the oxidized LDL. So the inflammation recruits monocytes into the vessel wall, which then differentiates into macrophages. So macrophages phagocytose, or basically consume the oxidized LDL and becomes filled with fat, which becomes known as foam cells. Over time, the foam cells accumulate in the intima to form an enlarging lipid core. This fibrous connective tissue accumulates around the lipid core, forming a fibrous cap. This is basically the development of an atheroma. Now, what is an atheroma? Atheroma is a lipid-filled plaque that can enlarge and eventually impinge on vessel lumen. This is basically how atherosclerosis is formed and how the plaque buildup is formed. So the plaque causes thickening of the arterial walls, which then produces arteriosclerosis, along with the calcification of the arterial walls due to the loss of elastic fibers of the muscles in the body. As you can see on the left side of the screen now, there is a lighter yellow colored box wherein complications of the arterial and the venous thrombosis are enumerated. For the complications of arterial thrombosis, there is a thrombotic stroke as mentioned earlier and the myocardial infarction. For the complications of the venous thrombosis, basically parts of the clot can break apart and become embolus, and this travels to different locations, which can therefore cause portal vein thrombosis, renal vein thrombosis, jugular vein thrombosis, Budd-Chiari syndrome, Paget-Schroeter disease, and the cerebral venous sinus thrombosis. Now, what are the complications of thrombotic disorders? First, basically it depends on where the thrombosis is located. For the venous thrombosis, serious breathing problems can occur. Deep vein thrombosis and pulmonary embolism can also occur. Pulmonary embolism is basically an emergency situation wherein emergent treatment is needed, or else the patient may actually die within an hour of the thrombosis being formed. For the arterial thrombosis, there is a thrombotic stroke and myocardial infarction or heart attack. For the medical and surgical management and treatment modalities of thrombotic disorders, there is the medical management, which is the anticoagulation drugs, specifically the parenteral heparin or the low molecular weight heparin. There is also oral warfarin or the direct oral anticoagulants, and thrombolytics. For the surgical management, there is a catheter for clot removal and inferior vena cava filter. For the therapeutic or treatment modality, there is compression stockings for deep vein thrombosis patients. Next, what is a possible nursing management for patients with thrombotic disorders? These are just a few of the possible nursing management for patients with thrombotic disorders. First is to assess and monitor vital signs and the changes of level of consciousness of the patient. Assess for contributing factors and signs and symptoms of thrombosis and bleeding. Monitor platelet counts and coagulation test results like INR, prothrombin test, and the partial thromboplastin time. Provide brief explanations of what is happening and expected effects of an intervention. Keep the head of the bed elevated. Provide oxygen therapy as indicated. Provide and administer medications as prescribed. Provide teaching regarding the safety measures while on anticoagulant therapy, such as the use of an electric razor and the use of a soft toothbrush. So what are the possible nursing diagnoses for patients with thrombotic disorders? These are just some, but there could be a lot more. First is impaired gas exchange related to altered blood flow to alveoli or major portions of the lung, or it can also be related to the decreased lung perfusion. It can also be ineffective tissue perfusion related to hypercoagulability of the blood, or it can be related to blood stasis or blood vessel wall injury or obstructed pulmonary artery. Next, deficient knowledge related to unfamiliarity with the present physiologic condition, its treatment and management. Fourth is the risk for bleeding related to abnormal blood profiles. So, what is the outlook for patients with thrombotic disorders? The prognosis of thrombotic disorders depends on the location of the thrombosis. For pulmonary embolism, this is an emergency and may lead to death if not found and treated immediately. For portal vein thrombosis, it can be treated with non-invasive procedures and treatment if found early. For deep vein thrombosis and other thrombosis, the prognosis depends on early diagnosis and treatment. Otherwise, it may cause serious complications, disabilities, and to some cases, death. So basically, that is all for thrombotic disorders, and this is just a summary and what everyone needs to know about thrombotic disorders. Thank you for listening and thank you for watching. I hope you watched the last video, which talks about a summary of the hyperhomocysteemia and acquired thrombophilia.